Hi, Professor Carson. I'm going to do my head to toe assessment practice right now on Brandy. So I'm just going to enter. Hello.
Hi.
I'm
Come
going
in.
to do my hand hygiene.
Okay.
My name is Bridget D'Souza. I'll be your student nurse today.
Okay.
And can I know your first and last name?
Brandy Bryden, 1393.
Okay, can I call you Brandy?
Yeah, Brandy's good.
Okay, so I'm just here to do a quick assessment on you.
Okay.
Which is going to be including to listen to your heart sounds, lung sounds, range of motion,
Mm-hmm.
and do like temperature and vital signs,
Okay.
pulse and all that, okay?
Okay, perfect.
And well, it's gonna take at least 20 minutes
Mm-hmm.
in this area. If you feel any uncomfortable, just let me know and I'll stop the procedure.
Okay.
And are you in any pain right now?
I'm not.
Okay, and any allergies?
I'm not. I
Okay.
do not have any allergies, I'm sorry.
Okay. So do you know where you are?
I'm in my house.
What time is it?
It is 5.
The day?
It is Wednesday.
And why are you here?
You're assessing me.
Okay, patient has LOC times 4, and patient is sitting upright. Patient's facial expression is blank. Mood is blank. I can hear her clearly, so speech is clear. No physical deformities. Patient doesn't have any glasses or any visual equipment. Patient's well hydrated, appropriate to the weather. Dress is appropriate to the weather. And no odor coming from her. Well groomed, and patient state the age, posture and body contour is nourished. And okay, while going through that, no hearing aid on. Okay. Okay, so I'm just gonna go through the. Uh-huh. And can I, so I'm just gonna look into her skin. While looking into her skin, there's no scar, lesions. There is one scar on her right forearm. No tattoos, piercing. Temperature is warm to touch. And the, what's it called? Oh my goodness. Sugar is, well hydrated. Capillary refill is less than 3 seconds. Nail is pink, round, in shape. And okay, while I'm here, I don't know where patient was going. While I'm on her face, okay, just keep moving. While I'm looking at her face, her eyes is symmetrical, ears is symmetrical, and nose is symmetrical. There is no lesions on her eyebrows or eyelids. And while I'm gonna get the pen light, so I'm just gonna check your pearl, which is like I'm just gonna flash the light onto your eyes, okay? Okay, if you could just look into the pen light, the tip of the light. Okay, Pearl, pupils equally round, reactive to light, and if you could just look into the tip of the pen light, just move your eyes, not your head, okay? Okay, and close one of your eyes, so left eye, and I'll do the same. And let me know when you see my finger, okay?
See it. See it. See it.
Okay, and the other one.
See it. See it. See it.
Okay, and could you pull down on your eyes? And there's no lesion, drainage, or redness or tenderness or swelling around the eyes. So conjunctiva is pink, sclera is white, and that was cranial nerves 2, 3, 4, and 6. It was intact. And going into her nose, can you look up for me? There's no foreign bodies. There's little hairs. There's no polyps. Nasal septum is not deviated, and nose is symmetrical. And can you close one of your left nose, take deep in and out, and right. Okay. Patency is bilateral, and there is a left nair pierced, and that was cranial nerve 1 is deferred. Going on to her ears. Does this hurt?
Nope.
Does this hurt? Okay, tragus bilateral doesn't hurt upon palpation. While I'm palpating, does this hurt?
Nope.
Okay, ear doesn't hurt upon palpation. Looking onto your ear, there's no skin breakdown. or lesions, tattoos, or anything. Looking onto her external auditory meatus, there's no piercing, redness, drainage, or lesions. And looking onto her right side, there's no skin breakdown, lesions, tattoos, or redness or tenderness. On external auditory meatus, there's no lesion, drainage, drainage lesions or redness. And her earlobe bilaterally is pierced. So I'm gonna just do a whisper test. What that is, I'm gonna whisper 3 words, and I'm gonna have you repeat back to me. Okay? I'm just gonna stand behind you and close your left.
Left ear, okay. Left. 1, 2, 3.
And do that on your right.
1, 2, 3.
Okay, so cranial nerve 8 is intact. And while I'm gonna wear gloves, and I'm just looking into your scalp now, okay? So I'm just gonna palpate, so let me know if you have any pain or tenderness.
No.
Okay, does this hurt?
Pain, no.
Okay, patient's head is normocephalic, no tenderness, no pain, no abscess. There's no infestation, there's no alopecia, hair is evenly distributed, evenly distributed. So I'm just gonna, while I have my gloves on, I'm gonna just look into your mouth, okay? If you can open up, the lips is not chapped, teeth is intact, buccal mucosa is moist and pink. Can you lift your tongue up? Frenulum is intact, the tongue out, the tongue is rough, say ah. Uvula raises upon phonation, posterior pharyngeal is pink and moist. And can you clench your teeth? Okay, can you say light, tight, and dynamite?
Light, tight, dynamite.
Okay, well, here, I am gonna have you close your eyes for me and let me know where I touch this, okay?
Forehead. Cheek. Chin.
Okay, that was cranial nerve 9, 10, 12, 5, and 7 was intact. While I'm doing that, I'm gonna have to check one more thing. And can you frown for me? Raise your eyebrows, puff your cheek out, smile. And that was cranial nerves 9, 10, 12, 5, and 7. And I'm just gonna check your lymph nodes. I'm just gonna take this gloves off. Check your lymph nodes right now. That was preauricular, postauricular, occipital, submandibular, submental. Can you turn your head to the right side? And that's digastric and posterior cervical and deep cervical. Jugular-digastric, posterior cervical, and deep cervical. Can you shrug your shoulder? And that's subclavicular. And while I'm here, I'm just gonna check her carotid pulse. That was carotid pulse was +2 bilateral. Can you shrug your shoulders for me and push against my resistance? That was 11, was intact. While I'm to the neck, can you turn your neck to the right, left, up, and down? Full range of motion onto the neck. If you could stand up for me. And if you can walk normally to the door. And when you come back till here, just put heel to touch heel to toe. Okay, well here I'm gonna look for the gate. So if you can just stand normally and close your eyes, hands to the side. And I'm looking for Romber's test, just so I'm gonna listen for this 20 seconds. Okay, patient has negative Romber's test. And if you could do flip your arms back and forth as fast as you can. Okay. And while you're turned out, I'm just gonna listen to your posterior chest, okay? And wherever I place my hand, just say 99.
99. 99. 99.
Okay, tactile fermentals is equal bilaterally, and chest expansion. Can you deep breathe in and out? Expansion symmetrical. AP diameter is 2 to, can you move your arm up? AP diameter is 1 to 2. And does this hurt?
Nope.
So no pain, tenderness, or masses while palpating or posterior. So I'm going to listen to her lungs. So since there's clavicles, it's take deep in and out. Okay, raise your arms. So right had 3 lobes. And left has 2. Okay. And can you bend down for me? No scoliosis, lordosis, or kyphosis. Okay, if you can sit down. And I'm gonna check her anterior chest. Let me know if this hurt, okay?
No.
Okay, there's no past masses, tenderness, or pain upon palpation. I'm gonna listen to her lung sounds. Take deep breath in and out for me. Okay, lift it proper. Okay, and I couldn't hear any unlabored breathing or respirations. So I'm gonna listen to her heart sounds. So it's gonna be first intercostal space on the right sternal border is gonna be aortic. Second intercostal space on the left left sternal border is gonna be pulmonic. Third intercostal space on the left sternal border is gonna be Erb's point. Fourth intercostal space on the left sternal border is gonna be tricuspid. Fifth intercostal space on the left, mid-clavicular is gonna be mitral. Here I'm gonna listen for 1 whole minute for her apical pulse. And I'm gonna turn the stethoscope to the bell side to listen for any murmur. So it's fifth intercostal space. Fourth is gonna be tricuspid. Third intercostal space is gonna be Erb's point. Second, pulmonic, and first gonna be aortic. And there was no murmurs heard. Patient's heart rate is regular rate and rhythm. And I'm gonna look into her abdomen. While in normal circumstances, I would lift up her patient's clothes up to look for any masses or tenderness, but at this point, I'm not gonna do that. So looking at it, there's no masses, tenderness, hair is well distributed, there's no piercings or tattoos. And while inspecting that, and there's no patient's abdomen is flat. There's no pulsation heard. So I'm gonna listen to the vowel sounds for 1 whole minute. So I'm gonna start from the right lower quadrant. I'm gonna work my way up to the right upper quadrant, left upper quadrant, and left lower quadrant. Vowel sounds was normal, and I'm gonna listen for any bruit. So no bruit were heard, and I'm gonna do a light palpation. So in that, let me know if you have any pain. Okay.
Okay.
No. So no pain upon palpation. And now I'm just gonna look into, while I'm here, I'm gonna listen to her radial pulse. Okay, so in those normal cases, I would have patients' hands pulled up, but I'm not doing that for the scenario. and patient has no edema, no scar, no lesions, no tattoos on the leg, and I'm gonna listen for dorsal pulse. Dorsal pulse is +2 bilateral, and if you could pull against my resistance, push against it, and abduction, and flex your knees, both, just your knees. Okay. And patient has full range of motion on the lower extremity, and can you abduction and flexion, and can you pull against my resistance and push against my resistance? Okay, patient has full range of motion on her upper extremity as well. And if you could sit up for me. While I'm here, I'm just gonna go ahead and do a quick vital signs. Have you had anything hot or cold to eat or drink in the last 15 seconds?
Mm-mm.
No? Okay. So for vital signs, I would have a thermometer, which would be this is a thermometer, which is gonna go underneath your tongue. And I'm gonna get that reading. And then this is gonna be a pulse oximeter, which is gonna go on this arm. Just leave it there. And then in this arm, I'm gonna listen to her respirations, I'm gonna just take her arm and cross her chest and listen to her chest rise for 1 whole minute. Once I get that, and then I'll get the readings for the pulse and oxygen saturation and room air. And for blood pressure, I'm gonna have my cuff and tie on her left upper arm, and I'm gonna ask, what's your baseline? Do you know what your baseline?
120/80.
So she says 120/80. So for 120, I'll add up 20 more, and then the first sound I get would be the systolic, and then the last sound I hear will be the diastolic. While I'm here, if you can look up. And trachea is midline, and can you swallow for me? Okay, I forgot to do one more, so I'm just gonna do that really quick. And so that's gonna be sharp, and that's light. Okay, and let me know where it is. Okay.
My arm. It's sharp. Light. Sharp. Dull.
Okay, patient can't tell the difference between light and sharp pain. So I think I conclude my assessment. Do you have any questions for me?
No.
Okay, and I'm gonna do in hand hygiene, and here's your light bed on the lower position, and I'm gonna give this results to the doctor. Let me know if you need anything, and I'll come back. Okay? I'm gonna exit the room.
Thank you. Thank you.
Thank you.